Hey, John.
Hi.
Hello.
Hi,
Hi.
Ajay.
Hi.
Hi, Sal.
Myself.
Liv.
Hey, Day.
Hi.
Liv. Haley. So, Day, Carrie and Kevin are not attending.
I don't believe
Harry just
Okay,
popped
just
in,
as-
actually.
Yeah.
I don't believe Kevin is attending.
Carrie's attending, but not Kevin.
Correct. Hello.
Hey, Carrie.
Hi, how is everybody?
Good, how are you?
Great.
All right, thanks.
Okay, I think we can 7:02. We can call the meeting to order. So why don't we start with roll call? Just state your name. Adi. State your name. Oh, we can't hear you. Oh,
Okay, it should work now.
oh, that's good.
Adi Bengali present.
Okay. Sal,
Sal Vermonti here.
Carrie,
Harry Janelle, here I am.
Sophie,
Hi, Sophie Hansen.
Joan,
Joan Wetzel.
and Rick. Great. So tonight, in terms of the agenda, we have minutes from our last meeting and also from the special meeting on October 27th. Public comment, if there is any. Right now, I do not see anybody. And then we have an administrative hearing on the matter of Reading Shell at 110 Main Street. We're going to follow up on the hauler regulations, which we discussed last time, and a assessment of, or just an update on where we are with our community health improvement plan. And then our usual monthly report, and we'll wrap up. So with that in mind, no other additions or other items? Okay, yes,
I
Karen.
have a question, Rick. I'm sorry. I haven't met Adi before. Do we have a new member of the board? What did I miss?
Adi was appointed in June, and I think he made one meeting, and we haven't seen him for a variety of reasons. But he's an associate member as of June.
Great. That's great. Welcome, Adi. Nice to meet you.
Nice to meet you, Kerry, and I will be much more regular. I think there was a miss on my part where I did not take the oath. And so
Yeah.
Adi and I talked, and we thought it wouldn't be appropriate for me to attend anything till I took that. Now that's all settled. So here I'm good to go.
Good.
Great.
And I think
Welcome.
we went around at the one meeting he attended and introduced ourselves. Maybe Carrie, you might know.
Yes. It was probably the one that I was out on medical leave.
Right,
And
right.
so very nice to meet you. Welcome. Glad to have you.
Okay, in terms of the minutes from our last meeting on October 9th, any comments or edits, suggestions, revisions?
I didn't have any.
I did not.
Okay.
None from me.
And the minutes from October 27th, which was just that we had a quorum attending the that special meeting of the select board.
Yeah.
There's really nothing to edit there. Just
Mhm.
okay. So I'll make a motion to approve the minutes of both October 9th and October 27th. Do I have a second?
Second.
Carrie, second. Roll call, Sal,
Yes.
Carrie,
Yes.
Joan,
Yes.
and Rick. Yes. All right. Okay. I don't see any members of the public here, so we're going to move on from public comment and go right to the matter of Reading Shell at 110 Main Street. So I'll make a motion to open the hearing in this matter. Can I have a second?
Second.
Okay, second Sal. Roll call, Sal,
Yes.
Carrie,
Yes.
Joan,
Yes.
and Rick, yes. Okay. Maybe I would just, we've all introduced ourselves, and maybe I would just ask Christina and William to introduce themselves, and Haley, if you can give them access to audio and video.
That should be all set.
Okay.
Can you hear me?
Yes.
Okay. Okay, and you're on too.
Okay.
Thank you.
Thanks.
Hi, good evening, Mr. Chair. I'm Attorney William Grammer on behalf of Reading Shell.
Okay. And Christina?
And I'm Christina Sideropoulos. I'm the owner of the Shell gas station at 110 Main Street.
Great. Okay, welcome.
Thank you.
So just to kind of remind everyone as how these administrative hearings work. The matter before us is really around the violation and, alleged violation, whether it occurred. That's the really the key issue. I'm going to turn the meeting over initially to Ade to introduce Ade and Maureen Busby, and hear their comments and what the facts of the case and what they want to say about it. The members of the board might ask questions just about clarification around that. And then we'll turn to Christina and William and allow them to speak regarding their, comments, perceptions, and again, the board members can ask clarifying questions. And then at that point, we will adjourn the administrative hearing, and then the board members will go back to our board meeting and have a discussion about what we heard and either make a decision, or if there are other issues unclear, we can defer the decision. But that's sort of how this works. And so with that, I'm going to ask Ade to introduce Maureen and kind of take it from there from what you want to talk about.
Right. Thank you very much, Dr. Lopez. My name is Ade Solari, the Health Director for the town of Reading. I'm here with Maureen Busby. She's the Tobacco Control Compliance Coordinator for the town of Reading as well. A tobacco product was sold to a minor at Reading Shell on September 27, 2025 at approximately 6:05 p.m. The violation comes with a fine of $2,000 and a suspension of the store's tobacco license for 7 days. This is considered their second violation within a 36-month period. The first offense was on January 6th, 2024. It was a $1,000 fine. They paid it. They came to the board. There was a hearing. Their license was suspended for 3 days. On a side note, the FDA also issued a warning to this store for violating the Family Smoking Prevention and Tobacco Control Act by selling to an underage purchaser. This happened in May, I believe, May or June. Christina is here tonight with her attorney. From what I understand, they've put measures in place to prevent this from happening again. And I would, let her speak.
Okay. Actually, can I ask a clarifying question? And actually, Maureen, when the individual under your supervision goes in to make a purchase, how old is he or she? And B, does he or she present some identification of some sort? How does that, just so we have a good idea of what that interaction looks like?
Yeah, thanks. I'd be happy to review. Can you hear me?
Yes.
Yes.
Okay, great. I'd be happy to review the standard protocol that we use. First of all, we only use trained youth. These youth have to undergo FDA training as well as training by me. And I've been doing this program for 14 years now. And on the day in question, as we do at any other time, we visited every store that sells tobacco products in Reading, with the exception of the golf club, because the pro shop wasn't open at the time. So we didn't go there, but we went to all other stores. What happens is I pull up to the store and the youth leaves my car. They have only money that I've given them, and they are not allowed to take their ID with them. And that is important because the training that they receive and a requirement that we have is that they tell the truth in all interactions with a clerk, so that this is not a situation where there can be entrapment. The youth goes in, asks for the product that I told them to ask for. It might be cigarettes, it might be vapes, it might be oral pouches, whatever it was. That day we were doing vapes, and the youth went into the store, asked for the product, was able to purchase the product without being asked for an ID. If the purchaser, the youth buyer, had been asked for an ID, the youth would have been able to answer truthfully, "No, I don't have one," and that's important. The youth came back per protocol, came back to the car. We immediately I put a sticky label on the product with the store name, address, the date, the time, the amount of the purchase, and a code that indicates which youth it was. We used to take a photo of the youth right after a product purchase but that was back in the days when the clerks were required to ID anyone who looked like they were 27 years of age or younger. But now the state law, and it's been that way since 2020, the state law is that a tobacco purchaser of any age has to be ID'd. We call it ID all. All purchasers have to be ID'd regardless of how old they look. So again, this purchaser came out to the car. We tagged the evidence, then I put it in a Ziploc bag. At the end of the route, the rounds that we're doing that day, I take the products that it may have been purchased that day and put them in a locked cabinet in the health office. And I immediately write to the health director and say, we did a round of checks, here are the results. And so that protocol was followed that day. And as Ade already mentioned, that there was a sale of it happened to be a Crave Max 2500 vape, disposable vape device, which I have with me. We're not in person. Normally I would bring these to the meeting, but I have it here, and Ade has photocopies of it.
And how old was the youth?
This was a 17-year-old female buyer.
Okay, great, thank you. Any other questions before we move to Christina and William? Yes, Carrie.
Just one. Maureen, had this buyer been someone that had done these compliance checks in with other organizations or with you, or was this their first time?
No, she's reasonably experienced. I've had her for a couple of years. She started at 16 and she's done all of the towns in my collaborative.
That's great. Thank you.
You're welcome.
Okay, Christina and William, whoever wants to start. And
Sure, Mr. Chair, I'll be brief. Christina asked me to be here tonight to sort of assist her as needed and sort of to get some more information. I think she was a little bit unclear on what happened. She will tell you that she didn't become aware of this until last week, November 17. I think the town's letter is dated prior to that, but she didn't become aware of it herself till last week. And so she doesn't have footage of the purchase. The tapes overwrite themselves after a period of time. And the employee is also no longer working with the store. She happened to be terminated shortly thereafter for other reasons. So Christina has been trying to piece together sort of what happened and what went wrong. And she's going to describe for you what she knows and the system that they have in place for scanning of IDs, which I think you'll hear from her tonight is the only way that a sale will go forward now, that the ID must be scanned versus the register clerk being able to manually enter a birth date. I think previously you had that choice. You could scan the ID or you could enter the birth date after looking at the ID. The new software that they've purchased, and she had forwarded to the board, I think earlier today, some documentation of the software and the purchase of all of that. It now requires that the ID be scanned for alcohol products. So I will turn it over to Christina and let her give you some more information and answer any questions you have.
Sure. Okay.
Thanks, Bill. So I first want to start off by saying thank you to everyone for allowing me to speak tonight. And Adi, you've been great with helping me throughout this process. Like Bill had said, I found out about this last Monday, and I've been really trying to deep dive into what happened just so I can get the full picture, so I can see what went wrong, how we can prevent this, and where the issue is happening within the company. So yes, I just want to really quickly say thank you to you too, Adi, that you've been a great help. So I wanted to also say that I'm the owner of the store, so I take full responsibility of any employee who sells tobacco to a minor. I try my best to implement procedures and have systems in place that won't allow that to happen. So I was extremely upset, discouraged when, you know, I saw that email on Monday come in. So deep apologies that it's even come to this point again of being here in front of you to even say, to go through all the things I found out over the weekend and last week. So yes, a little bit of background on me. I've done courses with other police departments on how to properly check IDs, what procedures and systems are new in the gas station industry that will allow us to prevent sales to minors, what signage to have up front. In every recommendation I hear, and I'm always open to more recommendation, we try to implement at the store. We do take this very seriously. So like Bill was saying, and I mentioned before, I found out on Monday, the 17th, that this occurred in September 27th. So our camera footage stores for 3 weeks. So everything was long gone by the time I found out. I believe a letter was sent to me the week prior. So I think that came into the store about November 12th, which was still, I think, like 6 weeks after the incident. So I wasn't able to go back to our cameras to look and see what happened. You know, we purposely have cameras all around the register for incidents like this that I can go back and see exactly what went wrong, what happened exactly. So because of that, I had to do this deep dive to get the best information that I could for you guys to present here and answer the questions that you guys have as best that I could. So based off of the violation letter I got, the incident happened September 27th around 6 o'clock. So I went back to our records to see who was the employee that sold to a minor. So that was an employee named Shannon. I have sent over some documentation. I'm not sure if everyone has received it. I think I'm allowed to screen share if anyone has any questions or want me to pull any photos up or documents up. So I believe Shannon, who was the only woman working at that time, was the cashier who sold to a minor. Shannon had started working with us in August, so a month before this happened. And coincidentally, the 27th was her last day of working for us. She was terminated the next day of her work, the beginning of her work, which was September 29th. And that had nothing to do with this. This was poor performance of her making mistakes in other areas that we've been constantly trying to retrain her at the store. So coincidentally, this happened on her last day of working with us. So she no longer works for us. Yeah, so we don't have her at risk of selling to anyone else in the community. So we've tried to implement ways to prevent this from happening from before this took place. One thing that we've done was have a very in-depth handbook. The handbook has a section that clearly states tobacco policies. I've sent that out to everyone as well, and everyone has to initial each page and they sign the back page. This is something that they fill out with the manager. Most of the times the area manager is also involved in the hiring process to answer any questions that they have, and during the 2-week training we go over exactly how to implement the things that are in the handbook. We also, because the handbook is so in-depth, have a single page, more in-depth. I think if I can share, I think I can, let's see if I can share. Can you guys see my screen?
Yes.
Yep.
Yep. I have the rules and regulations. So this is what she received also as a 1-page document that we give to all of our employees, not just her. You know, it states you're in an area where it's 21 years old, that you have the legal age is 21 to sell tobacco, that they need to check ID for everyone with no exceptions. Employees must, at this point in time, was when she was hired, was to either scan the ID into the register or manually type in the birth date. This is done because people sometimes have passports, or if there's an issue with scanning the ID, they can just physically type in the birthday. They press OK to continue. If the age is over 21, it proceeds with the sale. If it is under 21, the wholesale cancels. So we have them sign this at hiring and once a month thereafter. So we do monthly retraining at our stores. The manager will go in to each employee and have them go over each of these bullets and consequences and have them re-sign. And then there's also a monthly log that they've been spoken to about the importance of tobacco, checking for IDs, and the importance of not selling to minors. It's very important to not get caught, but it's also important to not sell things to minors in the community. That's the main thing. I personally would never want a minor to smoke, and I would hate it for it to be done at my store. So, we are trying to really implement, for all cases, no selling to minors, and just how important it is to the town, to all the people that are in the town, that you should never sell to a minor. So yes, this is what they have. They re-sign this every month, and they re-sign a single page. I think I also sent that over to you guys. We have the monthly training log where each employee will fill out their name and that they've been spoken to that month by the manager, or in other times the area manager, of how important it is to check for IDs. We also have our camera system. So we have a camera system that encompasses the entire POS area. So it encompasses also the tobacco counter, cabinet, the register, the customer, in different angles, so you can kind of see what they're doing. So we have our manager spot checking, and we also have the area manager coming in at least once a week to spot check and see what's going on with the store. We have signs in place throughout the store. So we have signs on the doors when people enter, and at the register that we check, we ask for all IDs for everyone, and that the age is 21. So we're hoping that people don't even attempt to buy. They get discouraged when they see the signs that they're not going to be able to buy at the store. In addition to that, we have a secret shopper. I can pull that up as well. So
we can just see the thumbnails. So if you want to open those up to see the content.
What was that, Bill?
If you could double click and open up the files, all we can see are just the small thumbnails.
Oh, can you see it now?
No.
Oh, I'm sorry. On my screen, I can see the whole thing.
I think you have to go in and actually
You have to open it and then share the open
Yeah.
document. You can't.
Oh.
Yeah, just open it on your screen, not on our screen.
Oh,
You
I'm
probably
sorry.
shared
I've been
just-
opening it this whole time.
Well, we could see the other one
wasn't
small.
sure.
We just can't read the small print.
Yeah,
on that
I think
one
you
you're talking.
shared a window versus the screen.
Yeah.
So it's probably that so all we see is just the,
Oh, share
folder.
screen. Can you see my screen now?
Nope.
we
Yeah.
still see the same folder.
If you go back
like
into
documents.
share screen, it should pop. Yeah, now.
There we
There
go.
it is. Yep.
You see it now?
Yep.
Yes.
Yes.
Oh, I'm sorry about that. I'm not too good with Zoom.
Yeah, no
Okay,
problem.
that's good. There you go.
Very good.
Thank you, Bill. Thanks. So here are the bars program. This is the report we get each month for the store. They come once a month, and they will either give a green card or a red card if the cashier properly asks for identification and a red card if they fail to ask for identification. So I went back to the beginning of this year and all of them are green. I even include, I think they didn't come in the month of May, but I included our QuickBooks where we pay them, that we never paid them for May. They just never came in that month. But each month is green. So 100% green cards, 100% green cards. I can go slower if anyone wants to see. I also sent this out to you and can resend it as well. So, you know, this provides me with like eyes when we're not there, when a manager is not there, if an employee's alone, and all of them have been green. You know, I went back, I think, until December. Yeah, the month of December, and it was all green since then. So we tried to use that to also show to the employees that we are checking, that we do take this seriously, that it's not worth it to sell to a minor. It might make something easier now, but it's not worth it. You know, you don't know if that's going to be the secret shopper, and they do get the green cards. You know, everyone gets happy when they get the green cards at the store too. So yeah, so these are some of the stuff that we've done and that we've, you know, tried to really implement more things along the way. So we've kind of just started building on everything. So back in, I believe it was June, we got a letter from the FDA saying that we had a violation at the store. They sent out a list of recommendations at that time. Can you guys see my screen?
Yep.
Okay, so this is what the FDA gave me. And it was a checklist of things to do. And at that point in time, when I sent it, it was July 8th. These were all the things that we had implemented. So this was before this current violation that we're talking about. So the first one states that we have, that we display signs that we ID anyone under the age of 30. I know the tobacco, Miss Busby was explaining, you know, the FDA here, I think, told us to do 30 years of age. You know, we didn't want to have any confusion, so we said to do all. So that's why in our employee rules and regulations, we wanted to be everyone. We didn't want anyone to say, oh, they looked 29. So we just made it easier for our employees and just required it for everyone. It also wanted us to have a minimum date of birth required to purchase and have that on a calendar. So that is built into our register. So our register will display that, so there's no confusion with the employee. You know, the retraining that I talked about already, being aware of the consequences. We have the consequences listed, that they will be terminated or fees can be applied to them, the ramifications to the public, monitoring the usage of IDs. So this is when we implemented the scan or manually entering the ID birthday. And that was the only way the transaction cannot continue without either scanning the ID or entering the birthday. Yeah, so we, in the secret shopper that I've talked to you about, the only thing is they wanted a standalone calculator. We, again, have that already built into the register. So we were able to implement everything on their list. So that brings us to now. That's why I was so shocked on Monday, and I know Adi probably heard how shocked I was to find out that we had sold to a minor again, because I have been trying to be on top of it as much as I could be. So this all happened in July, as I was saying, and actually since then, we did order, I can pull that up too. I did order you can see that we did order a new scanner because we switched it to scan only. So we wanted to update our scanner to the best scanner that they had, the most up to date, so that we could remove the possibility and move towards scan only. So no passports, just a scannable ID. This arrived September 12th. At this point in time, we should have been scan only. Again, why I was very confused that a sale went through. So yes, this brings me back to, I wish I had my footage to look at and see what happened. So I, spent this week trying to come up with how this could have happened so we can prevent it from happening again. I mean, that's the most important takeaway that I wanted to have. And, possibilities came up that, at that point in time in September, if the scanner was not properly implemented. I do have a photo of today. I took this photo. So when they scan the tobacco product, this pops up onto the register. It says swipe/scan license. It gives you the date, but there's nowhere for you to enter or proceed without scanning the ID. So there's no passports, nothing, just a scannable ID. And the only other option is to hit cancel, which would not proceed with the transaction. So if it was working properly as I believed it was at that time, the only other option I could see is if she was entering in another item for this product. I'm just trying to go through and see what could have happened at that
Or
point.
the X button wouldn't work.
So if it was like this, if you hit cancel, it doesn't pull up the tobacco product to continue.
What about the X button?
No,
X.
that would just cancel it.
Okay.
I can have a video sent to you if you would like, from the manager over there. He'll be in the morning. That if you hit the X, it will not proceed forward. The X or cancel, there's no proceeding forward without scanning ID. It will not pop up the price or for them to even proceed with payment. Unless they're giving it out for free. Then that's the only other option, I guess. It just wouldn't show.
Right.
It wouldn't allow them to even hit cash or credit to accept payment.
But we know that the girl paid, correct?
Right.
We're 100% sure. Oh wait, we're not sure.
I'm not sure. If you're asking me,
Right. I'm asking the general question because you didn't have the camera, and I mean, to be devil's advocate, what if the cashier did give it to her and she didn't give her cash?
I'm not sure. That's why I wish I had the camera footage.
Right.
That's why I even extended it to 3 weeks. I believe when we first bought the camera system, it was 1 week, and I found that incidents were getting discovered later. So we bought an extension to our camera system so that we can have it for the full 3 weeks. So yes, I don't know exactly how it happened. I don't know what kind of conversation they had between the 17-year-old girl, the minor, and the cashier. The cashier, again, she was terminated. That was her last day of work. I believe she knew she was being terminated. She was getting constantly retrained, and her hours were getting shortened because of her inability to really do the work properly. And we were trying to make it work with her, but it didn't. And I think she knew that. So I don't know if this was something that she did, out of spite of that. I'm not sure. I don't know if this is something, I don't know. I didn't get to talk to her about it because she no longer works for us. I like to speak to them and see what their perspective is on it. I don't know if she, because I think she did ask for ID. I got a report today from a D saying that the minor that she said to the minor, "Oh, just give me your ID next time." So to me, that implied that she had asked for ID, but the minor maybe said that she didn't have it or she was of age. So I don't know if the cashier got confused. I'm not sure again on that aspect. So I'm just
So,
doing my
I just
best.
I just have one quick question. I mean, so did we get a receipt for the product? Did we get a receipt from the cashier?
If
I'm
you're
not I'm not asking you,
Oh,
Christina.
okay. I'm sorry.
Yeah,
Yes, could I answer that?
sure. Yeah.
We tell in the training, the youth are told explicitly not to ask for an ID. I mean, I'm sorry, for a
A
receipt,
receipt.
not to ask for a receipt, because most tobacco customers do not ask for a receipt, and that would be a dead giveaway. That's called a tip to the clerk. If a young person comes in, buys a tobacco product, asks for a receipt, that's a tip off. So
Right.
if
So,
a receipt is automatically given, which in 14 years I've never had a youth come out with a receipt, but if a receipt is automatically given, then of course we accept the receipt, and that would go in the evidence bag with the actual tobacco product. But I do have thank you very much, Christina, for all that information. And Ade did share those attachments with me earlier today, and I told him that I appreciated that you've gone to such lengths to make sure that this doesn't happen again. But I do have a big concern about the tobacco regulations that are in place in Reading, which are different from the state law. So you're correct. State law is a purchaser has to be age 21 to buy a tobacco product.
Yeah.
But in Reading and 18 other communities in Massachusetts, there's a different local regulation, and that regulation is called NFG, or nicotine-free generation, and that requires that that there's an not an age restriction, but a birth date restriction. And for Reading, that birth date restriction is 1/1/2004. So the clerk is not looking, or should not be looking, at the birth date for age. They should be looking at the birth year to make sure that the purchaser was born in 2003 or earlier. If they were born in 2004, even if they're already 21, they can't purchase a tobacco product because they were born after the cutoff date. This happened in September of 2025, so that wouldn't apply here. But since we're having this discussion about state law, federal law, and local regulations, I just wanted to make sure we cleared that up. And in your store, as in all Reading stores, there's a local Board of Health regulation sign. And I didn't go and check today, but I believe in your store, there's one on the door as well as one at the counter. So are you familiar with that, with the local Board of Health regulation?
Yeah. So, sorry, I just want to get back to that one question I had though. So is it possible for the cashier to have just pocketed the money? Is there a receipt? I guess is what I'm getting at. How do we know that the cash wasn't just pocketed and she didn't go through this step?
Point of order, Mr. Chair.
Sure.
Yes.
Just on, as we're proceeding in the hearing, it's not clear to me whether we should simply be hearing from the owner of the store and their recounting, and then whether we would close the hearing and deliberate,
Yes.
or whether we're supposed to be engaging
Oh,
in
okay.
dialogue
No.
and back and forth.
I don't know either.
I know
Sorry,
we
get
talked
here.
about, no,
Yeah.
it's not, it's fine.
Okay.
I just want to make sure we're doing it right. I mean, I'm interested in sort of the bounds of clarifying questions, and I want to make sure we're doing this as we should be.
You're right. I was interpreting Sal's questions as clarifying.
Yeah, that's
I'm not
what
gonna
I
solve history
yeah.
here.
I think that when we bring Maureen in, I think that's when we have sort of gone
Yeah.
beyond. And it was why I was raising the point of order. I think I'd love to hear from Maureen as
Yeah.
part of our deliberations. I wasn't sure if that was appropriate to have it be
Yes.
part of our hearing. Is
Well, that-
my
Right.
part of the hearing as opposed to our deliberations, if that makes
The
sense.
hearing is really more for factual reasons,
Okay.
like, you know.
I'll hold my
public-
question then. Yeah, sure.
Okay. Can I'm just gonna ask one question, and just out of curiosity, in your in the document that you sent that shows each month how many, purchases were made and cards were swiped, green, red, and so forth.
Yep.
It looks like there's only one a month or two. Are your tobacco sales that slow?
No, so that is a secret shopper that we pay for in addition.
Oh, that's a secret shop.
That's
Okay.
a secret shopper. Yeah,
Yeah.
so we pay, it says it on it. So it looks like we pay $31.50 per time they come in. So this is
Okay.
a secret shopper. It's very similar to what the town does.
Yeah.
It is someone who is
Okay.
underage or looks underage, and they go in and they see if they ID them.
Okay. Great. Thank
so
you for that
And
clarification.
it says visit type, so they came in specifically for a tobacco product. It says the date. It also tells you the employee
Right.
who got the green card, and they will give one green card to the cashier. They will mail a green card to us, and then they send out this report along with the bill where we pay them
Okay. Thank you.
every month.
Are there any other questions for Christina before we adjourn the hearing?
I wanted to just clarify, I think about what the local regulation is and whether there was signage or not. It sounds like there is appropriate signage, that there's awareness of what the local regulation is, and that no tobacco products are to be sold to anyone born after December 31st, 2004. Could we go back to that picture of the signage that you have, and does it include that there?
I don't believe it does. I don't believe the signage does. We have this on our doors. So can you see the photo?
Yep, I
Yeah.
can. Yes,
So
thank
it
you.
says all customers, we scan IDs, we
Right.
card, please have ID ready. Law prohibits sale to anyone under the age of 21. So
Okay.
it does not include the September 2025
Local regulations.
local regulation, which I will be sure to update that. And I know maybe I can get your contact information, Miss Busby. Maybe
Just
that's
to
something yep.
Right.
Fine.
Just to clarify, that's not September 2025. That's the it prohibits sale of tobacco to anyone born at 2000, the first day of 2004 on, and that was adopted
In June of 2004, June of last
2000,
year, 2024.
yeah, June of 2024. So
And maybe a day could send Christina a copy of the current tobacco regulations, just so she can read through it. It would be useful. But I noticed that some of the pictures do talk about you have to be over 21, and so that's not quite correct.
Yes.
but thank you for showing the pictures.
Yes.
I have this, it's the same thing in a smaller setting on the register, but it does not say that. I will get it, hopefully in the next couple of days. I'll research and see how quickly I can get it, something that says, the no one born after, January 1st, 2004.
Correct.
I'll
And you may have to reconfigure the software on your scanner for the same amount.
Yeah, I will do that first thing tomorrow morning.
Carrie?
Yeah, I'm sorry, just another clarifying question. When I'm looking back at my notes, and you had indicated that the scanner arrived. Could you go back to that document that you're showing with the scanner?
Yes. Would you like me to explain the document? I can.
Well, if I could take a stab at it, what I see is an invoice dated September 12th for delivery of scanner ID to an address in Tewksbury. And I just want to clarify, I thought that you had said that the scanner arrived in Reading on September 12th, but is that, did I get it mixed up?
No, so the way that we do, because we have a couple stores, this is one of our stores, they bill to this one store. New Hampshire delivery is we go to their New Hampshire store. So our maintenance guy went to their, so it says ship via New Hampshire delivery. They went to their New Hampshire location and picked it up. And I know that that's confusing. I also sent out, this is our check that when we paid it, it
Right.
was, and you can see, we paid it,
Well,
there's in October. You can see in the memo, it's for Reading MA 110, and it has that. So I knew that that would be a little confusing. That's just how, you know, we have a couple stores, that's how they bill us.
Right.
for-
So I'm trying to sort this through because I don't see anything in this that shows me that the scanner product or the scanner software update was installed on September 12th. I see that it was purchased on September 12th. I see that it was paid for in October. I'm just trying to follow the chain here of what document you're showing us that tells us that it was installed and received in Reading on September 12th.
Yeah. I don't know how I can prove to you that it was installed. I'm not sure if it was installed the 12th or the 13th. You know, when we got it, our IT guy picked it up. I'm assuming he went in, not our IT guy, our maintenance guy, installed it immediately.
Okay,
So
thank you.
I don't have, I'm sorry, I don't have anything for you to show you.
That's okay.
I can
Thank
have
you.
a statement
Thanks
from
for
him.
helping me. Thanks for helping me clarify sort of the dates. I was confused.
Yeah, I wish I had something, like, I'm not
Well,
sure, but I
that's
can
fine.
talk to
That's
my
that's
maintenance
okay.
guy.
That's
Yeah,
okay.
I want to make sure that, you know, I have everything for you guys, and if you need anything else, that I could do that. Sorry about that I don't have that with me.
If there are no other questions, I'd make a motion to adjourn the hearing and move back to our meeting for discussion. Is there a second?
second.
Mr. Chair,
Yes.
just a quick point of order, I guess. I just wanted to find out, when you talk about the consequences of a violation, the health director had indicated, you know, a suspension of 7 days. Is that up to 7 days? The way I read your regulations, it could be anywhere from 0 to 7 as opposed to a mandatory 7. I just wanted to raise
I
that.
believe it's a mandatory 7.
All right.
And the first violation, mandatory 3, and the third violation, a mandatory 30. So did I have a second?
I
Carrie,
second.
did you
Yeah.
Oh, Sal did. Okay. Roll call, Sal,
Yes.
Carrie,
Yes.
Joan,
Yes.
and Rick, yes. I want to thank Christina and William for being here. Christina, you did a lot of work in sorting this out and giving us the full picture, and we appreciate that. And we're going to now go into our regular board meeting and have a discussion about it. You're welcome to stay on if you would like, although Haley will be sort of restricting your audio and audio.
Okay. Okay, thank you.
Yeah, thank you.
Yes, thanks for coming in.
Okay, so comments, questions, discussion.
But I think the last violation we discussed, there was no room for even discussion. It was, the rules were the rules, right? Wasn't that what it was?
Yeah, the regulations are written pretty starkly,
Yeah.
and definitively, and we've had a couple of these over, or at least on my 5-year term so far, we've had 2, and you know, the readings of the way the regulation, from my reading, is that really the only issue in the hearing is whether or not the violation occurred, whether there was some error in declaring that violation, not whether there should be any adjustments in the
Exactly.
penalties.
That's all I
And
remember.
I think
yeah.
for me, I mean, I think it's great what Christina has done. I mean, the amount of effort put in, the conscientiousness, you know, it's really super. And I wish all of our retails did it.
Yes.
On one hand. On the other hand, what I would say is, you know, we're only counting 2 from the town of Reading, but this is potentially the 3rd. But you know, this is only 2 for the town of Reading. And you know, it's Philly. I don't think there's any dispute that a violation occurred. And my concern is always a slippery slope. If we start to waiver or make waivers for time or penalties for this occasion, then the next time there's an occasion with another store, you know, there's a precedent setting that we have made changes and we have adjusted. And how much subjective judgment do we really put into this? And I think that's why, you know, the issue is really around the violation. And actually, I was looking at the Mass Association of Health Boards, their materials on this, and they're very clear. The hearing is really, did the violation occur or not? If the result of the hearing is it did not occur, obviously no violation, no penalties. If it did occur, they're really, the regulations don't allow for a whole lot of wiggle room. So that's my take on this. Carrie.
Can I just ask if we could have the current regulation pulled up? Because what I see, I'm not sure I'm reading it quite the same way. And I want to make sure I'm reading the most current thing. I agree with all of your comments, Rick. I mean, I think that the efforts that they went to are commendable. I think that the fact that the sale occurred indicates exactly why there need to be the measures of, you know, that we can rely on folks to do the right thing, but that, you know, ultimately the scanning only is preferred. And, you know, I mean, we as a board agreed that we were very concerned and really adopting a policy that would be stringent and not, you know, letting our vendors know that we do not want sales to occur, that the penalties are stiff, and, you know, that there isn't a lot of room or tolerance as much as we may.
A day, do you have that? Do you have the current version?
I'm
Yes.
about to pull it up right now for
Okay.
everybody. Can everybody see that?
Yes.
Yes.
Is this the current version?
Yes, I pulled it right off of the town's website.
Okay, I would go to the very end.
Yep. I
Uh,
just want to make sure, to Attorney Grammer's point, I don't know if perhaps there are different pieces, because I pulled something from the website that I read a little differently, so.
What section did you want me to go to? Sorry, I don't know if I heard you.
In the instance of violations
Violation.
yeah.
and penalties. That would be the-
So
Okay,
here is
stop
where the
right there.
violations begin.
Yep, thank you. Can you make it a little bit bigger for eyes that
Yeah.
maybe could use a little?
Yeah, definitely.
Yeah, okay, down here. Let me see. Is that better?
Yes, thank you.
Welcome.
So I think the sentence in number 4, midway down, it says, after a hearing, Reading Board of Health shall suspend or revoke product sales permit if the Board of Health finds a violation of this regulation occurred. It's pretty black and white there.
Yeah. I'll just go back to section 1B, which
Yeah.
says in the case of a second violation, if you read just the last sentence, product
May.
sales permit may be suspended for 7 consecutive business days. So I'm not sure if our regs are I think there's a.
It's interesting, yeah, in
the
1A,
may,
it says shall be suspended,
right, and this is may be suspended.
and then may on, actually on the 3rd.
And I wish that Kevin were here because I recall we had a lot of conversations. I know other folks remember, but we had a lot of conversations about this and the question of, did we want may or shall? Were we going, how are we going to do it? And we were, dead clear that the initial violation was absolutely a, non-negotiable, but
The
in what
second one
has
looked
been
negotiable.
adopted, the second and third, we did go with the may with a maximum amount. I hate to muddy our waters, but to Attorney Kramer's
In my
point,
opinion, it seems like it could be less than 7 days with the may word.
yeah.
I mean, my opinion on this whole thing is I agree with everybody that Christina did a ton of work, and she really almost foolproofed her whole business. But it's everybody has humans in their business, right? And every human is going to make an error. I feel like she went above and beyond for her business, and to get the maximum penalty for a human error that we can't control every human 24 hours a day when they're there. That's kind of, if we could give any leniency on the 7 days, I would be for, giving a little leniency on the 7 days.
So, if I may, Mr. Chair, just while I raised this question of the may, I did not do so because I was necessarily interested in leniency. To my thinking, some of the things that Christina cited are things that are required by law. They're required by law to have signage. It's lovely that she has it, but it's a requirement that be present. It's not an extra going above and beyond. And, they did go with the can scan or manual enter. And that is a point of failure. That's a well-known point of failure for sales of these kinds of things, both for alcohol and for tobacco products. It's not an unknown. It's not a, ooh, that's a surprise. I appreciate the concern of whether, she didn't have camera footage, and isn't clear exactly what happened. But at the end of the day, for us, I'm not sure that it matters what happened. The point is that someone of underage is not supposed to be able to purchase tobacco products or nicotine products.
Yeah, I would also say that unless we have robots, dispensing the stuff, there's always going to be the human element. It can always be, for any violation, you could always say, well, people make mistakes. We can't control everything. That is just the nature of this business. And so I would feel personally that I agree that this individual, Shannon, obviously, perhaps, was a error-prone situation, but generically, it's always going to be a human who's making a mistake.
I mean, I'm, you know, I live in Reading. I have 4 kids. I'm probably a 200% against, you know, 1,000% against tobacco sales to kids. 100, you know, all the time. The one other thing that I did remember though was that there was no signage for the 2004, which was kind of concerning as well, I
Yeah.
guess. Now that I'm thinking back to that point as well.
Yeah. I also, the reason I had asked Maureen about the age of the youth was it's a 17-year-old female.
Yeah.
And that is not something, she could have been 25. I mean, at 17, she looked underage, regardless of either the 21 rule or our nicotine-free generation. 17, she looked very young. Human error, whether it was done out of spite because she was going to be fired,
Right.
I don't know, but it was pretty blatant. And it was the third time in a year and a half. So
Third time?
The FDA violate your because the FDA violation, because there was a sale of a product from an FDA inspection. So that would be,
okay, yeah.
that would be the third time. Is that what you're?
No, the
Oh.
FDA, we only are responsible for the violations that Maureen
So
has.
What was the third one?
Well, this is
Oh,
the
so-
second violation.
But we only the third. We're on the second violation, though, right?
We're only on the second violation for the town.
So I'm
The
confused on the
FDA
third one.
violation in June of this year doesn't apply to our deliberations here.
So that was the third you were talking about, was the FDA.
Yes.
Okay.
Okay. So we're not supposed to consider that?
I believe that is the case. Yes, we didn't have control over that. We weren't. That was done separately. I think this regulation, if we go back, it really applies to the town's regulation
Yeah,
of tobacco sales.
I
not
agree. I agree with
what
that.
the feds are doing.
That's not.
So then if we've got the May, like, I think, was our intent, was there some space for an egregious violation would get, so I think that's the question is, what's the degree, that we're concerned
so I
with
think
this
we ought to,
violation?
I think someone ought to make a motion and we ought to vote on, the dollars and the issue of a suspension. I mean, I would be happy to make a motion. If it doesn't pass, then we can consider another motion. I think we ought to try to bring this to a conclusion.
Yeah, I feel like the 2000 is shall be. I feel like the 2000 is non-negotiable.
Yeah.
That's what it seems like it's written like to me.
Yeah.
So I'm going to make a motion, and feel free to vote your conscience here and vote what you think is best. But I've kind of put myself out there. So I'm going to make a motion that, that this vendor ought to be, for the second violation, ought to be issued a $2,000 penalty and be suspended for 7 consecutive business days as determined by the health director in discussion with the store manager. Do I have a second or not?
Second.
Second, Joan. All right, so we'll start here. Sal?
Sorry, can I ask if there's any discussion on the motion? I know we haven't heard from Joan, so I particularly just want to make sure there's space for her before we move to a vote, Mr. Chair. Thank you.
Sure. Joan?
My only comment was that it seems like it's particularly frustrating for Christina. She's trying to do it right, but ultimately she's responsible for her employees and who she hires. So unfortunately, I think in this case, the violation is clear and
the penalties need to be the consequence.
Is there, do I have a second? Joan, did you second?
I did second,
Yeah,
yes.
okay, so let's do a roll
Sal.
call. Sal?
You're muted.
Sal.
You're on mute.
I would say yes.
Carrie?
I would say yes.
Joan?
Yes.
And Rick, yes. Okay. Well, I think that was a good discussion. It's difficult, I think, when you see an individual like Christina who's really trying to do the right thing. And so it's hard to not to feel like we need to make our own rules. But I think in terms of the violation was clear, it certainly wasn't the first. And I am concerned about precedent setting because there will be another violation at some point in the future. And, you know, having made a judgment here, you know, it confuses the issue a bit in the future.
Maybe we can go back to the rule too and put
Yeah, maybe we ought to go back to those two mays and make it clear.
because we're only
Yes.
supposed to be deciding yes or no, not the severity of the offense, right?
Right,
We're
there's
just
no space in there for it, agreed.
right. I mean,
Unfortunately.
if it was written the other way, if it was written shall, I would have been yes, 100%, right? But it leaves a little gray area there because
Yep.
we have somebody like Christina who's really trying. So okay,
We
So-
should bring that to a future meeting
Yeah.
For an edit. Yes, Carrie.
Mr. Chair, do we need to, I know in the past, we have assigned the dates on which the suspension would occur. I don't see anything in the regulation about that.
In the motion, what I suggested was that a day can work with Christina to select the 7 days.
Oh, I'm sorry, I didn't hear that. So, okay.
Yeah, you know, that's sort of an administrative issue. And,
Okay.
you know, which 7 days? Maybe I should have counted it sometime in the next month or whatever, but I'm sure a day will work out something that's
I just had one question for a day as well. A day, is it law to have have the local rule posted as well?
I believe so. They should have it posted.
I mean, it's yes or no. I get like.
Matter of fact, they do have it posted somewhere in their store.
Oh, they do.
Correct. NFG law. Correct.
Did we distribute
Yes, we did
But
to
we
all the
did.
establishments.
Oh, I don't.
what the
Yes.
posting should
Yes.
example?
Yes.
Okay. we did.
Yes. And I'll say, I'm glad to hear that they did have it posted, but that still their point of sale system isn't set up to
Right.
reflect that.
Yeah.
So posting absent action is, yeah, they're still not
Yeah.
there.
I just wanted to make sure that they did
Yeah.
have it posted, right?
Yep,
I didn't want to leave the meeting and still not be posted.
agree.
Okay.
Okay. Moving along, Adea, are the hauler regulations ready or not, or?
They're not ready yet. We're still working on them.
Oh, okay.
So if the board decides to meet in December, they should be ready. If not, then it will be January of 26.
I don't see them as a urgent thing, so
Correct.
we could probably defer to January. Which brings us to the chip update.
All right, I can give a quick introduction and then have Liv give us a quick update. As you all Remember, the health department partnered with peer associates to conduct a community health needs assessment and improvement plan from February 2023 to July 2024. Using the data from various sources, surveys, and focus groups, 3 health priorities were identified. First one was preventive health screenings and treatment services. The second was health environments and inclusive programs. And the third was healthy eating and active living. Our public health nurse, Liv, has been working diligently to ensure that these health priorities are being addressed as we plan our public health activities and programs across town departments. Liv, you can go ahead and give us a quick update.
Wonderful. Hello, everyone. I am going to share my screen. Okay, is everyone able to see that?
Yep.
Yep.
Perfect. All right. Oops, sorry. So as Ade said, we have our 3 main priorities: preventative health screening and treatment services, healthy environments and inclusive programs, as well as healthy eating and active living. I'm just going to go over how we have made some strides towards these goals this past year, and some priorities that we could look into for 2026 and beyond that we are kind of seeing a gap in. So for our first health priority, preventative health screenings and treatment services, we have our first and second goal: improve awareness and support linkage to mental health. So in 2025, we had 3 different vans come to Reading, or sorry, 3 different health screenings come to Reading. We had the Beltone hearing screenings. We had 3 different dates for our municipal employees as well as town members, and we were able to have 44 individuals be seen for hearing screenings. We had the 2020 Vision van come to the Reading parking lot on March 26th. We had 17 individuals screened for that Vision van, and I know that we had 3 follow-up appointments from that visit for individuals who needed further corrective treatment. We brought the Dana-Farber mammography van to do breast mammographies on our folks on April 29th. We had 19 individuals seen at that van, which was pretty fantastic. We had 21 slots, and so we were only missing one of those slots, actually, instead of 2, because one person needed a longer appointment due to their complex medical history. We had blood pressure screenings this past year. As we know, I hold 3 per month at 3 different locations to ensure accessibility. I had a total of 121 appointments in 2025 and more to come with the rest of the year. And our Reading Coalition for Prevention and Support was able to serve 3,500 residents this year. Some goals that I think we can look forward to and look towards in 2026 would be holding additional hearing screenings with our Reading Fire and Police Department. That is something that I am in talks with both chiefs. They're interested in that. As well as continued screenings for the community, as well as assessing needs for additional blood pressure screenings and additional locations to make this more accessible. And then definitely looking into increasing our transportation services throughout the town. We do have the van at the senior center that is able to support our senior population, but I would love to see what we can come up with, especially as we move into building of ReCal. All right. Moving on to health priority number 2, healthy environments and inclusive programs. Speaking of ReCal, that is one of the main things that we're hoping that can support the creation and promotion of healthy spaces. We are in our, middle leg here. So we are doing the construction documents still and working on that. We meet regularly to discuss the initiatives that we want to hold at the ReCal Center, as well as how we want to structure it to provide support for all residents of Reading, no matter the age. With our goal number 2, increasing opportunities for community connections and supportive services for those in need. We've had 10 after-hour recreational programs this year, as well as 13 after-hour health programs, and I had 122 attendees at those health programs. And those ranged from CPR classes to Narcan training, to different just health priority screenings. Building resiliency among the youth. We started our teen talks this fall. I've had some pretty good attendance. Definitely been able to talk with some of our young folks about how to keep their bodies healthy and doing some hands-only CPR training with them as well, which they've found very fun and informative. Some opportunities for this next year with funding secured to support staff in our new Recal building, as well as work to improve ADA compliance in older buildings. And we have a new town ADA advisor appointed this year. So we're hoping to have some meetings with him and definitely get some things established throughout town. Moving on to health priority number 3, healthy eating and active living. So to increase health behaviors across the lifespan by making the healthy choice the easy choice. So we had 4 nutritional educational programs after hours this year, serving 65 individuals. They were very well attended and very well received. And I've had some requests to bring back some of those individuals who facilitated the programs. Like I had mentioned, we do our teen talks at the library, and this has definitely also increased the conversation with our youth about health and wellness topics. Some opportunities for 2026 would be to establish community education campaigns, and I would like to identify some key stakeholders and perhaps build a task force of some sort. I don't quite know where to start this conversation, but in our chip, there was some talks about doing a Reading farmers market. I know the Wakefield one is very well received, so perhaps that's something that we could look into in the future. And then to create more walkability and bikeability promotional materials throughout the town. And that is all I have. Any questions, comments, or concerns? Hi.
Yes, Karen.
Thanks. This is great. Thank you, Aday and Liv, for this work. I have just a couple of questions. I know this was just a quick recap for it. Thank you for making it, tight and tidy for us. In terms of data collection, so that we can demonstrate improvement and identify areas where maybe we need to keep looking. Do you have historical data from last year? And it's okay if you don't, because some of this stuff never happened and data collection wasn't necessarily a priority. If that's the case, then this would be baseline and we would be looking to be able to compare like to like and say, yeah, we did great with this. And because we had such a high demand for mammogram van, we're going to have them come twice a year now or whatever. I'm just curious about what the kind of data collection and evaluation plan is for this. That's one question.
Aday, would you like me? Oh, say it. Go ahead.
Yeah, after, I mean, you can talk as well, but like after each visit or each clinic, we usually get like a summary of the attendees and things like that. We get the mammography van once a year. I think in 23 we had more people. In 24 we had less. Sorry, 22 we had more. 23 we had less. 24 we had more. So we're keeping the data. The CHNA is due every 5 years. This was conducted in 23. So in another 2 years, we should be looking at doing another one. So
right. Yeah, just thinking because it's a helpful thing for as you're thinking about programming for the year. If you can look, as you said, yeah, well, kind of demand is up and down, so maybe we just leave it at once a year. But maybe something else, people are bouncing out the door. But it sounds like you guys are on top of that, and I'm glad to hear it. Then I guess it's kind of two pieces of the same point. So when we did this process, we were clear that while this is about the health of the community, that we didn't want the responsibility for everything in the chip to fall on the health department because there's not a lot of staff and there's, y'all have busy jobs. So I just am curious if you've had opportunity to have other departments collaborate with you, or if you need the board to do anything to encourage that collaboration. Because we love the work you're doing, but I know that there are other departments doing work as well, and we ought to be thinking about the health of the town collectively.
So I think we are in a great space at the moment. Again, this wouldn't have been possible without, Liv joining the team. She's great at, bringing people together, collaborating with different departments, and she's been, great. I'll let Liv talk about it as well. I know that she collaborates with the senior center, police department, fire department, the food bank, the library. She's all over the place. So
Right. Yeah, well, and it just before so I noticed you made the comment about the walkability, which I think is great. And I think it's Ace Folds runs a walking group, and that ought to be right. So that one is you don't have to start walking from, are you tackling it from a different angle, or, let's give credit for the whole town and include that as part of it, because we want to include it for the next chip. We want to be acknowledging that. And I'm sure Jenna has programs at the rec department that, and the schools and the like. So we want to broaden it without making more work for y'all necessarily.
so go ahead.
Sorry, I just wanted to make a small comment that in the last chip update, I kind of did a deeper dive into how all of the other programs throughout the town were kind of contributing to everything, how the Reading Coalition data was contributing to our chip versus how the senior center was versus the schools and all that stuff. And I kind of consolidated it this time, so I didn't add all of that data this time, Carrie, but I do have collaborations with the different
I knew
departments.
you did. You guys are on top of it. I just want to, okay, thanks.
And so like prior to Liv joining us, the health department was compartmentalized. Like the nurse was under the health department. The nurse had nothing to do with the senior center.
Right.
It was just for the health department. Now that Liv is here, she's able to like work with multiple departments. She can
Great.
see what they're doing. She can bring that knowledge over here. We can come up with a program that's going to work. So I guess the key here was when we changed the position of the public health nurse to include the senior center. That opened up more doors for us, and it's been wonderful.
That's great. That's great to hear. Thank you. Thank you. Here's
Thanks,
my chance
Aday.
to say thank you again. You guys
Sal,
do.
did you have a question or a comment? Sal?
No,
Oh, okay.
I was just
That
clapping.
was a yay.
Yeah, I was clapping.
You were clapping.
Yeah.
I clapped too.
Yeah.
No, that's a great job, but I like the idea of, maybe an appendix next time we do this in 6 or 12 months, whatever. An appendix with numbers of, numbers of people screened for their hypertension or blood pressure or whatever. That would be useful to track over the 3-year period, just to make sure we're making progress.
It's always hard to figure out what information to include. You don't want to include too much, but you don't want to, I appreciate, I think I like that idea of an appendix, Rick.
And I do have some of the data, like we definitely have data from the vans and the individuals that come in to do the screenings. But when it comes to like blood pressure and things like that, I'm kind of starting from scratch on that kind of stuff, or like how many people came to so many programs at the library. So I will build upon that data, definitely.
You have a lot of the same customers, Liv? Same.
I have a group of regulars in each location, but I do get a lot of new people quite often, especially when I go to the senior center and the library.
That's good to hear.
Yeah, I get a lot
Yeah.
of people that just stroll on in and they're like, I didn't know you were here.
Oh,
Right.
great. That's awesome.
That's great to hear.
Yeah.
Yeah.
We could
Great
also
questions.
include the data in our annual report. As long as we don't identify anybody,
Mm.
we should be able to do that as well.
Okay.
Yeah, recurring,
Great.
non-recurring. Yeah.
Yeah, that's great. This is so exciting to see, you know, Rick, right? I mean,
Oh,
this is-
absolutely. You know, when we looked at when we were doing this and we looked at what was done in 2015 and it went for 5 years and there was really it wasn't clear that there was a lot of follow through, and follow through is really important, you know, particularly in these long range type
Yep.
things. You know, it's easy to lose focus and to kind of stop paying attention because you're moving on to, you know, busy every other things. And so it's nice to see that this report, and I look forward to future ones, you know, that keep our focus for the 3 years. Yeah, absolutely.
I would love to, if anybody in the board has a burning desire that's not like a need that's not being met, I would love to discuss that in a future time with anybody that would love to give me ideas for the future.
Okay, great.
Thank you.
Thank you. You do a terrific job.
Thank you all.
Update a day.
Liv, do you want to start, please?
Let me pull it all up.
And then I'll just go after you and then we can wrap it up.
Perfect. Okay. Back to our regularly scheduled informational session, November 2025 nursing updates. So for the month of October, we had a dip down on our COVID cases, down to 15. I feel like I've noted this before for the board, but I did want to note this was something that Carrie had told me last year. Any information, any disease reports that we get that are less than 5 individuals for the town, we are not supposed to report, as it is, it could be seen as a HIPAA violation. So just because I don't have flu on there doesn't mean I had like between 1 and 4. Just means I didn't have more than 5. So the flu in October definitely went down, but it is November now and it's coming right back up. So if you haven't gotten your flu shot, please do so. All right, for the month of December, I have my 3 blood pressure screenings. We have it on December 4th at 11 at the Senior Center, December 15th, 2:30 at the library, and December 18th at 10 a.m. at Frank Tanner. For the month of December, we have a few awareness months. It is HIV and AIDS Awareness Month. Just wanted to highlight the 1.1 million cases we have throughout the United States, and just to bring awareness that we should always continue with this research and advocating for those that will need assistance, especially in these times when being immunocompromised is not very fun. It is
And
also
given that AIDS was a death sentence and now is
Yes.
not, is something that you can live with successfully with treatment. It's so important. Thank you for highlighting
Yes.
that. Sorry for interrupting.
No, please. It is
Passionate about this
so
topic. And
yeah, is very, very important. All right, it is also National Impaired Driving Awareness Month in December, so stay safe these holiday seasons. Every 42 minutes, someone dies in an alcohol impaired driving accident, and it claims over 12,000 lives annually. So plan your rides before the festivities. Do not drive if you are drinking. Just call a taxi. It'll be better. Those extra $12, it's better than your life. And then always wear a seatbelt, because sometimes it's not you, it's the other drivers. So even if you're doing everything you can, sometimes it's not you. Stay safe and stay sober. It is also Sharps Injury Prevention Awareness Month, quite a handful, a mouthful there. As Ade and Haley know, the sharp spin is the bane of my existence in the Reading Town Hall. So I just wanted to give a little Q&A here about how to use it. So is there a place to drop off your sharps? Yes, it's in the basement of Town Hall. Can I dump my needles in it? No, you have to place them in a closed plastic container. What's an acceptable container? You can use a laundry detergent bottle or a milk jug. Can I put medications in there? Nope, this is just for sharps, no meds. We generated 1,716 pounds of sharps in the 2025 year so far. So that is quite a lot. So this town, we're getting it and getting rid of it. So that's great. Having a healthy holiday season, just a way to keep up with your health throughout these times where we love to gorge ourselves. Load up on your veggies first, fill half your plate with greens, and then go for the protein, and then go for the mac and cheese. That's a way to kind of balance that out. Drink lots of water. Don't skip breakfast. Starving yourself on Thanksgiving Day is not the way to go. Take it slow. Take 20 minutes to finish your plate. Wait 10 minutes before getting your second. And then just remember it's okay to indulge a little. Moderation is key, though. And then take a nice walk after your meal or go play football or something. Just get moving and get the blood pumping.
Mhm.
And then some holiday safety tips. Cook your meat to 165 degrees. Separate your veggies and your raw meats on the cutting boards. Wash your hands thoroughly and store your leftovers 2 hours after. These are all ways to prevent foodborne illnesses, something that is also the bane of my existence.
Mhm.
All right, so data that I collected in 2025, people loved hands-on CPR classes. So for 2026, I'm making it a regular thing. Every other month, I will be teaching a class at the library. So we got January, March, May, July, September, and November. I don't know what happened on my printing there, but I'm gonna have to fix that. So you can find me at the library on those dates from 5 to 6. If you have anybody that is interested in doing hands-on CPR, hands-only CPR classes, just to learn how to do proper chest compressions, send them my way. I am getting trained to be an instructor this next month. So hopefully we can bring some certification classes to the town, which is something that I've been hearing a lot of want and need for, especially at the library. And then I've got one more public flu clinic coming up on December 10th from 4 to 7 at the Reading Public Library. I've had great attendance on those, and we are almost out of our stock, so that's really great. I'm very, very excited about that. Always can order more though, so do not fret. And then if you know of anybody that needs a homebound flu shot, please send them my way. I will do those until nobody's calling me. So. And then always be aware that I still have my diabetic supplies take back and my medical supplies take back programs for the town. Thank you.
Thank you, Liv.
Thank you.
In the month of October, we conducted 2 foodborne illness inspections, 1 housing complaint, 11 food establishment inspections, we issued 9 temporary food permits, 16 annual food establishment permits, and the permit renewals are ongoing. Most permits expire on the 31st, and so far we've had a lot of people, renewing their applications, which is a good indication that by January 1st, everything should be all set.
Great.
The health inspector position is currently vacant. The MEPHC has been helping us with inspections. We're grateful for that. We've started the interviewing process. We actually interviewed a couple of candidates today. We're going to be interviewing 3 additional candidates tomorrow. I'm hopeful that we will get the position filled very soon. Let's see. Yeah, that's pretty much it.
Want to just comment on the environmental analyst that we were gonna make a hire for, and what happened with that?
Oh, the MBTA?
Yes, right.
So the continuance was withdrawn by the MBTA, and as a result, we had to cancel the request for quotes. So we no longer have any need to conduct any studies at this point.
Any other questions or comments for a day or leave?
Just one a day out. And in regard to the MBTA, piece, I know there was some question of whether this, I've heard differing answers of whether this was a withdrawal. And they're just gonna go find another town to do this in, or whether they're gonna revisit the locations and perhaps come back and propose another location. Is there a definitive answer to that you
There's no
all have?
definitive
There is not. Okay,
at this point. I know that the town manager sent an email to MBTA. I'm not sure he has received a response yet.
Okay.
I'm hopeful that once he does, he would send that information our way.
okay. And if something comes up again, we have a ready RFQ
Yeah.
for use to,
Absolutely.
should we need to. So great, thanks for getting that work together. So be useful, hopefully not need to be useful again, but we have it, and that's good.
Absolutely. We're ready to go. Mhm.
Right.
And the collaborative has not hired,
We now have a coordinator for the
we do, we
collaborative.
do.
Oh,
So,
okay.
I think we have a meeting a couple of weeks from now. So
Okay.
our first meeting with the new hire. So
Okay.
All right, any final comments before we adjourn? Anything else? Other than happy Thanksgiving?
Great. Happy Thanksgiving. I'm thankful for the chance to work with you all, and
Oh,
thankful
man.
for our staff.
Great team.
we're thankful for you as well.
Happy Thanksgiving.
Great board.
Happy Thanksgiving.
Happy Thanksgiving.
Happy
Make a motion to
Thanksgiving.
adjourn. Second,
Second.
Carrie. Roll
Beat
call,
yourself.
Sal,
Yes.
Carrie,
Yes.
Joan,
Yes.
and Rick, yes. All right, thank you all.
Thank
Have a
you.
great
Happy
holiday. See you next
Thanksgiving.
year.
Happy
The next meeting's
Thanksgiving.
January.
Yep.
Good. Take
Right.
care all. Be well and be
Right.
safe.
Bye.
Thank you.
See ya.
Bye-bye.
Bye-bye.